Unlocking the secrets of coronary artery disease, causes, treatment, and prevention. Get ready to uncover the mysteries of one of the most common heart conditions in the world, coronary artery disease. Whether you're seeking answers for yourself or a loved one, we've got you covered with the most up-to-date and essential information. So, buckle up and prepare to embark on an enlightening journey into the realm of coronary artery disease. Hey there, welcome back to MindState. We're here to help you tap into your full potential and become the best version of yourself. In this video, we will delve into its origins, explore the causes behind it, reveal effective treatment options, and even share valuable tips on prevention. But before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. What is coronary artery disease? Coronary artery disease, CAD, is a common heart condition that affects many people in the United States. It happens when the blood vessels that supply the heart become narrow due to cholesterol buildup. This narrowing makes it difficult for the heart to get enough blood, oxygen, and nutrients, which can cause problems like chest pain, shortness of breath, and even heart attacks. CAD develops slowly and may not show noticeable symptoms until it becomes serious. Who gets coronary artery disease? Risk factors. Coronary artery disease, CAD, can affect anyone, regardless of age or gender. It starts when fats, cholesterol, and other substances build up along the walls of the arteries, a process called atherosclerosis. Several factors contribute to the development of CAD, including certain risk factors and lifestyle choices. Age is a risk factor for CAD, as the likelihood of developing the condition increases with age. Men generally face a higher risk of CAD compared to women, although women's risk tends to rise after menopause. Existing health conditions can also contribute to CAD. High blood pressure, high cholesterol levels, and diabetes are examples of conditions that can increase the risk of developing CAD. These conditions can cause damage to the arteries and promote the accumulation of plaque. Being overweight or obese is another risk factor for CAD. Excess weight puts additional strain on the heart and can lead to the development of other risk factors, such as high blood pressure and diabetes. Lifestyle choices have a significant impact on the development of CAD. Physical inactivity and a sedentary lifestyle can contribute to weight gain, increase cholesterol levels, and weaken the heart. Chronic stress can also have adverse effects on the cardiovascular system. Unhealthy eating habits, particularly diets high in saturated and trans fats, contribute to the buildup of cholesterol in the arteries. Smoking is a particularly harmful habit that damages the blood vessels and accelerates the progression of atherosclerosis. Furthermore, a family history of heart disease can increase an individual's risk of developing CAD. Genetics can play a role in the development of risk factors such as high cholesterol levels and high blood pressure, which contribute to the development of CAD. Symptoms of coronary artery disease. When the coronary arteries narrow due to conditions like atherosclerosis, the heart doesn't receive enough oxygen-rich blood, leading to a range of symptoms. It's essential to recognize these symptoms as they can indicate the presence of coronary artery disease, CAD, and the potential for complications such as a heart attack. One common symptom of CAD is angina. Angina can manifest as chest pain or discomfort that may feel like pressure, tightness, squeezing, or a heavy weight on the chest. The pain may also radiate to the arms, shoulders, jaw, neck, or back. Angina is often triggered by physical activity or emotional stress and typically subsides with rest or medication. Shortness of breath is another symptom experienced by individuals with CAD. During physical activity or exertion, the heart has an increased demand for oxygen. If the narrowed arteries cannot deliver enough oxygenated blood to the heart, it can lead to breathlessness or difficulty breathing. This symptom often resolves with rest or when the heart's workload decreases. Extreme fatigue or a persistent feeling of tiredness can also be a sign of CAD. The heart muscles may not be receiving sufficient blood supply, leading to a reduced ability to pump blood effectively throughout the body. As a result, individuals may feel excessively tired, even after minimal physical activity or during periods of rest. In severe cases, CAD can progress to a heart attack, also known as myocardial infarction. A heart attack occurs when a coronary artery becomes completely blocked, preventing blood flow to a section of the heart muscle. This can result in intense chest pain or discomfort, shortness of breath, lightheadedness, nausea, and sweating. However, it's crucial to note that some heart attacks can present with minimal or no symptoms, a condition known as a silent heart attack. Regular testing, such as electrocardiograms, ECGs, and other diagnostic procedures, can help detect CAD and identify any underlying risks. How is coronary artery disease diagnosed? An electrocardiogram, ECG, is a common diagnostic test used to evaluate the electrical activity of the heart. This non-invasive procedure involves placing electrodes on the chest, arms, and legs to record the heart's electrical signals. An ECG can help identify any abnormalities in heart rhythm, detect previous heart attacks, and provide insights into the overall functioning of the heart. Another test that may be suggested is an echocardiogram. This imaging technique uses sound waves to create detailed images of the heart's structure and function. It allows healthcare providers to assess the heart's pumping ability, detect any abnormalities in the heart valves or chambers, and evaluate blood flow. Echocardiograms can help determine if CAD has affected the heart muscle or if there are signs of complications. A stress test, also known as an exercise stress test, measures how your heart performs during physical activity. During this test, you may walk on a treadmill or cycle on an exercise bike while being closely monitored. The goal is to increase your heart rate and stress the heart while monitoring its response. This test can help evaluate blood flow to the heart, identify areas of reduced blood supply, and determine if CAD is causing symptoms such as chest pain or shortness of breath during exercise. In some cases, your doctor may recommend more invasive procedures to further evaluate the condition of your heart. Cardiac catheterization involves the insertion of a thin, flexible tube, catheter, into a blood vessel, usually in the groin or arm, which is then guided to the heart. This procedure allows for the measurement of blood pressure within the heart and the injection of contrast dye to visualize any blockages in the coronary arteries. An angiogram, often performed during cardiac catheterization, uses X-ray imaging with contrast dye to obtain detailed images of the coronary arteries. It can help identify the exact location and severity of blockages, providing crucial information for treatment planning. A cardiac CT scan is a non-invasive imaging technique that uses X-rays and computer technology to produce detailed images of the heart and its blood vessels. It can provide information about the presence of calcium deposits in the arteries, calcium scoring, or detect blockages in the coronary arteries, coronary CT angiography. Treatment options. Lifestyle changes play a crucial role in managing CAD. Adopting a healthier diet is key, which means focusing on consuming nutritious foods while limiting saturated and trans fats, cholesterol, and sodium. Incorporating fruits, vegetables, whole grains, lean proteins, and healthy fats can support heart health. It is also important to monitor portion sizes and limit the intake of processed and high-calorie foods. Regular physical exercise is highly beneficial for individuals with CAD. Engaging in aerobic activities like brisk walking, swimming, or cycling can strengthen the heart and improve cardiovascular fitness. Exercise should be done under the guidance of a healthcare professional who can help determine the appropriate intensity and duration based on individual circumstances. Weight management is another important aspect of CAD treatment. Losing excess weight can reduce strain on the heart and lower the risk of complications. A healthcare provider or a registered dietitian can provide guidance on developing a safe and effective weight loss plan. Stress reduction techniques can help manage CAD. Chronic stress can contribute to the progression of the disease, so adopting stress-reducing activities like meditation, deep breathing exercises, yoga, or engaging in hobbies can promote overall well-being. Smoking cessation is crucial for individuals with CAD. Quitting smoking significantly reduces the risk of heart-related complications. Healthcare providers can offer support and resources to assist in quitting, such as counseling, nicotine replacement therapy, or medications. Medications are commonly prescribed to manage CAD. Aspirin or other antiplatelet medications may be recommended to prevent blood clots and reduce the risk of heart attacks. Cholesterol-modifying drugs, such as statins, can help lower cholesterol levels and slow the progression of plaque buildup. Beta blockers may be prescribed to control blood pressure, reduce heart rate, and relieve symptoms. In some cases, medical procedures may be necessary to treat CAD. Angioplasty, also known as percutaneous coronary intervention, PCI, involves the insertion of a thin tube, catheter, with a balloon on the tip into the blocked artery. The balloon is inflated to widen the artery and improve blood flow. A stent, a small mesh tube, may be placed during the procedure to keep the artery open. Coronary artery bypass surgery is considered for individuals with severe CAD or those who do not respond to other treatments. This procedure involves creating new pathways for blood flow by grafting blood vessels from other parts of the body to bypass the blocked arteries. Discovering that you have coronary artery disease can be overwhelming, but remember, there are ways to manage and live with this condition. By reducing cholesterol, controlling blood pressure, quitting tobacco, adopting a healthier lifestyle, and managing stress, you can make a positive impact on your heart health. Education is key, so don't hesitate to seek information and consult your doctors about coronary artery disease. Thanks for watching, Mind State fam. If you found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.